Health remains one of life's greatest assets. Without it, productivity slows, dreams fade, and families struggle under the weight of medical bills. In a city as dynamic as Lagos State, access to affordable healthcare has become more than a social need. It is an economic necessity. That is why the Lagos State Health Management Agency, LASHMA, says it is taking the bull by the horns, driving compulsory health insurance, widening access, and pushing reforms designed to ensure that no resident is left behind. Present at the event were the Permanent Secretary, Lagos State Health Management Agency, LASHMA, Dr. Emanuela Zamba, the Permanent Secretary, Ministry of Information and Strategy, and Chief Host, Olanrewaju Bajulaye, the Vice Chancellor of Lagos State University, Professor Ibiyemi Olatunji Bello, ably represented, officials from the education and health sectors, media professionals, partner organizations, including the International Society of Media in Public Health, as well as students and parents, all gathered for the quarterly engagement aimed at reviewing progress and strengthening public awareness. According to the report compiled by Praise Matthias, the program opened with the national anthem, followed by a welcome address that set the tone for a day focused on healthcare access, youth engagement, and accountability. Bajulaye commended students who participated in the Ilera Eko essay competition and praised parents for raising future leaders.
Let me welcome you all to this very special program. Very special one in the sense that today for the first time we are actually taking care of our future. I sat down there and I saw the children and I said to myself, anything that you want done, you should let it be done by the children. And it is not strange when the Bible says, teach children on the way to go. When they grow up, they will not depart from it. This is our future. And I looked at the whole thing, and that's where we actually want to take the thing to. Normally we have this media parley quarterly, but today we are adding the spice because we want to hand over. I know once you tell the children this is good and they buy into it, it's something that will go round and round and will continue that way. Some of us still hold on tightly to some things that we learned as children and is working for us today. So I will say that this is the right time for us to be here today. And children, I pray that you will not fall into bad health because you have taken the right path. From now, you should go back to school and tell people about LASHMA. When you get back home, tell your parents about LASHMA. Tell your friends, tell everyone around you that government is set to bring health, good health, to our various doorsteps. Our colleagues, gentlemen of the press, our work is done once the children buy into this, and that is what we have seen. Some of them have gone through competitions, they've gone through series of research, and they have come tops in various categories. I want us to please let everyone in the whole world know what we are doing here today. Our parents, we want to thank you because if you have not brought these children, they won't be here today. And I pray that you will eat the fruits of your labor and you will not fall into bad health. Your health will be sound.
Goodwill messages followed, with speakers encouraging young people to remain creative, impactful, and committed to solving social challenges, regardless of their chosen careers.
Now I'm to be the goodwill message of the House of the Vice Chancellor, distinguished Professor Ibiyemi Olatunji Bello. First of all, I want to applaud LASHMA for organizing such a competition. And again, I want to congratulate the winners of this competition. But the message is start of small. I'm from engineering. The seven of our students in mechanical engineering is part of the UNA. I said, wow, that's fine. That one simply means, irrespective of your field, you can provide a solution. And I want to applaud you, the future leaders, that you should not delay. Your ingenuity, creativity is appreciated. I know there will be many entries. For you to have one of the winners is a team that should be appreciated and be appreciated.
The permanent secretary of the agency, Dr. Emanuela Zamba, expressed appreciation to all guests for being present at the engagement. Speaking on the reason for the parley, she noted that it is their commitment to remain transparent and be accountable, and it is part of their deliberate efforts to keep Lagos residents informed about their activities and achievements. On the policy update, she said the agency has intensified enforcement of the executive order mandating compulsory health insurance for all Lagos residents and workers. According to her, ministries, departments, and agencies (MDAs) have undergone compliance checks, while public-facing agencies can now verify enrollment status through their portals.
I am pleased to report that in the first quarter of 2026, the agency trained 72 journalists in 2 batches in collaboration with ISMPH on social health insurance. Please clap for us now. We are the first to the whole of Nigeria. This initiative underscores the critical role of health writers in amplifying the right message. We commend your professionalism and your continued partnership. You will recall that the Lagos State government, under the visionary leadership of Mr. Governor, signed an executive order in 2024 mandating health insurance coverage across the state. Following this, the agency has intensified enforcement efforts across ministries, departments, and agencies, resulting in increased enrollment among public servants. We appreciate the head of service, Mr. Olabode Agboro, for inaugurating the enforcement team and issuing directives that have significantly strengthened compliance. Today, I am pleased to inform you that the agency has completed its first compliance assessment of NDAs. Agency with public interface can now verify residents' enrollment status seamlessly through their portals. In addition, LASHMA has expanded stakeholder engagement across local government areas and local council government areas in line with recommendations from previous engagements. To further improve operational efficiency, the agency has restructured its sales department, introducing roles such as cluster managers for the senatorial districts, area coordinators for the local governments and local council development areas. This restructuring enhances grassroots presence, expands access to enrollment points, and simplifies administration processes across the state. Healthcare providers are also being trained in line with the executive order, and the next phase of enforcement will focus on provider compliance.
Providing updates on implementation of the Governor's executive order, Technical Assistant to the Permanent Secretary, Dr. Nifesimi Akinagbe, said enforcement is progressing in phases. The first phase targets ministries, departments, and agencies. Future phases will extend to the informal sector, vulnerable groups, and corporate Lagos.
As our practice every quarterly media parley, we're going to give you an update on Mr. Governor's executive order, Q1 2024, and it's the order of mandatory subscription, mandatory enrollment on the Lagos State Social Health Insurance Scheme, which is called ILERA ECO. So what I've said in all that English is that ILERA ECO is now compulsory in Lagos State. That's what that executive order is saying. Apart from the baseline assessment at the MDAs, we also did what we call the facility compliance readiness assessment. We went into the facilities. So all these hospitals, we wanted to make sure that they were ready to provide quality services. So if we are saying that ILERA ECO is compulsory, it's mandatory, we also need to make sure that the facilities are ready to provide qualitative services. And of course, also the areas of compliance approved for facilities as well, and we also checked these areas of compliance. We did the first phase from the 16th to the 27th of March, which in this first phase we looked at the PHCs, primary healthcare centers, as I mentioned, and some private hospitals. So for the phase 2 and phase 3, we're going to the secondary facilities like the general hospitals and also the tertiary facilities, the federal tertiary facilities as well. Apart from public awareness and strategic engagement, one of our other major responsibilities as stipulated in the executive order is vulnerable coverage. So individuals that cannot pay for a LASHMA, they cannot afford it. The government has made provision, and that's what we call the equity fund. And this equity fund has been increased from 1 billion to 3 billion in 2025, if I'm not mistaken. And currently, we do what we call town halls. For individuals that have been enrolled under the equity fund, we go into the communities and conduct what we call the town halls in order to get feedback in terms of service delivery. And of course, from my presentation so far, you've seen that apart from Ilera being mandatory, we are so big on quality. The Lagos State Health Management Agency makes sure that we are giving care that is qualitative enough. And one of the ways we can know that the enrollees are receiving quality care is through feedback. And that's what we get through these our town halls.
To tackle affordability, LASHMA also introduced Ilera Eco Easy Pay, a mobile wallet system that allows residents to save gradually towards health insurance premiums.
Okay, yes, interestingly, it's a child of necessity. Residents are asking for flexible options of payment. Things are changing drastically, so we needed to respond to provide an initiative that can avail people the opportunity to pay small, as we say. So they will pay money into their electronic wallet in conjunction with our partners. And when this amount of money completes the full premium, for instance, 15,000 for an individual, they can be activated and they can access care at the hospital end. There are other benefits that we'll be introducing as we get started, but we need to take it in phase by phase. So as we get started now, make your instrumental payment. When it completes, you can access care, continue your wallet savings, and then you can get interest on that savings and much more benefit that will be coming the ways of Lagosians as we continue to deepen the opportunity for this electronic wallet payment.
You have the opportunity to save gradually within a period of 3 months. You can save up to 15,000 naira and then we would activate for an individual plan. If you can save up to 55,000 naira for a family of 4, father, mother, and 2 dependents, you will be activated. If you can save 80,000 naira for a family of 6 within the space of 3 months, you will be activated. The terms and conditions do apply to these, but this wallet is an electronic wallet. You'll be able to view from your phone once you open this wallet in conjunction with our financial and tech partners. That money is strictly for Ilera Eco. But however, we will allow you the opportunity to be able to also use your savings such that you can also have interest on that savings, or particularly for the purpose of health insurance.
Beyond policy announcements, the Parley also celebrated young minds through the Ilera Eco essay competition, designed to raise awareness on healthcare, insurance, and universal health coverage. The competition attracted 731 entries, with winners emerging in 4 categories. In the Little Health Champions category for primary 4 to 6 pupils, winners received prizes ranging from 50,000 to 100,000 naira. The Young UHC Advocates category for junior secondary students offered prizes up to 150,000 naira. For the Future Health Leaders category, open to senior secondary school students, top winners received up to 200,000 naira. And in the UHC Innovators category for undergraduate and youths, the star prize stood at 250,000 naira. Winners were also decorated as Ilera Eco advocates, charged with promoting healthy living and health insurance awareness in their communities.
Ilera Eco is a scheme. Their idea is to make healthcare quite affordable and of a good quality to the residents of Lagos State. From today's activity, what I just want to tell residents of Lagos State is that they should enroll in the Ilera Eco scheme. It's a very good one.
I just want to say a big thank you to organizers of this competition and then this event. Thank you for honoring me with this award. I really, really appreciate it. I felt excited, I felt motivated, I felt thrilled because something to keep me motivated that success is not something that comes easily. It requires energy, requires consistency.
I feel excited because I didn't expect this opportunity.
I'm very happy so much. They are good to help family about debit. It helps family save money.
From policy enforcement to youth advocacy, from financial innovation to public engagement, the event reflected a clear message. Health insurance is no longer optional awareness. It is becoming a social responsibility. As Lagos continues its push towards universal health coverage, LASHMA says transparency, collaboration, and innovation will remain central to building a healthier state.